Good morning, good morning, good morning, good morning. Hey, it's Monday morning and ain't God good and won't he do it? Oh yes he will, oh yes he will. I know I'm listening probably saying, Lee Craft, Lee Craft, Lee Craft. You say the same thing every morning. I'm going to say Enoch, Ewok, Enoch. That means y'all sure know what to say. Look, hey, today is Medical Monday and I got Shay back. Shay has been a busy person. You know, we in the medical field, know every time you turn around, you're being called to come in and do all different things. Good morning, Shay.
Good morning, Unc. How you doing?
Doing fine. Hey, Shay, this morning we're going to talk about high blood pressure, right? And some of the complications of high blood pressure, Shay. So can you tell people about, a little bit about high blood pressure? But before we get started, if you have any comments or concerns, please email me at leecraftwhatever@gmail.com or go to Anchor, Spotify, YouTube, Facebook, all those beautiful apps. Look for the animated black man with a white beard smiling and profiling and finally, y'all trying to size me up. Shay, did it work again?
It did. It always does. You always get me.
So Shay, let the people know a little bit about yourself. What do you do?
Oh, I'm a nurse at St. Francis Hospital. I work on the telemetry floor, also known as the heart floor. So you would come to our floor if you have chest pain, high blood pressure, or may think you may have blockages in your heart or abnormal rhythm, anything like that.
So what is high blood pressure?
So high blood pressure is the pressure that blood exerts on the arteries as your heart is pumping. It's also, we call it in the medical field, you hear people say hypertension. Hypertension is what you'll hear the doctor say, but in regular terms, they call it high blood pressure. And it's also known as the silent killer because a lot of people don't even know they have high blood pressure till it's too late.
Really?
Mm-hmm.
So what are some of the signs of high blood pressure?
You don't have none.
Really?
So it depends. Now, they call it silent because the way the body is an amazing creation from God. So it's like if you don't go to the doctor on a regular basis, a lot of people don't even know they have high blood pressure until it completely almost causes permanent damage. So that's why they call it like the silent killer. It's really important that you go to the doctor and get yourself checked out for physicals.
That's why y'all do the little pump thing, check the blood pressure. That
Sphygmomanometer, also known as a blood pressure machine.
Okay.
If you're gonna say sphygmo or like that, yeah, we call it blood pressure machine. It's got too many letters.
Yeah, keep it simple for me.
Yeah, the blood pressure machine.
So what do the numbers mean for high blood pressure numbers?
So the top number is the systolic blood pressure. That's like the pressure when the heart beats. That's that top number. The diastolic is the bottom number. So because you know your heart is mostly, and it has to rest sometimes. It can't just beat all the time like that. So when it rests, that's the bottom number. That's the diastolic number. And so, they like to keep it, you know what, it's hard to say because when I was little, that's what you hear the old people say, oh, my blood pressure is 120/80. You're like, yay, that's good. Now, people saying now 120/80 is pre-hypertension.
Really?
Which is kind of crazy because it worked. I'd be happy to see 120/80. That's great because I've seen some astronomically high numbers, which is I've seen 200s over 100, and it's high blood pressure is a mess.
I take your word for it. So what are some of the causes of high blood pressure?
Oh, salt.
So what? That's it?
No, salt is the big one. So salt retains water. So since salt retains water, extra water puts extra pressure on those arteries. So that's why they tell you to do low salt foods and everything. Also, stress. Stress can shoot your blood pressure because I've seen patients because you know their trend, you know what their blood pressure has been, and when you go all of a sudden their blood pressure, I said, what happened here? And that's how I was arguing. I said, church, let's not argue no more because it's shooting your blood pressure up.
So stress is one of the main factors of high blood pressure.
It can cause it. Oh, smoking causes high blood pressure.
Smoking what?
Anything.
So you're saying cigarettes and marijuana, they fall in the same category?
Well, I say tobacco products, okay. Cigarettes, cigar, because smoking causes, and we call it vasoconstrictor, which means the blood pressure constrict. So it's like a water hose. You know when you want a water hose, if you plug it off, the pressure gets higher. Yeah, same principle in blood. Same principle in your body.
I never thought about it that way, Shay. Shit, man. So, what are some of the complications of high blood pressure?
is one of the main causes of kidney failure. That's why people on dialysis a lot of times, because your blood pressure in your kidneys are already high anyway, because it has to push out all the impurities in your body. So when you add, it's like, you know how it's when you carry your own weight,
Yeah.
and then you put another backpack on you, or the same difference like when you run in a car, it's running fast, but then you add the compressor from the air conditioning and it pulls pressure on the engine.
Yeah.
Same thing. You put extra stress on the kidney. And all that pressure that you have from not controlling will literally blow out your kidneys. And once your kidneys are gone, unless it's something like illness or something like that, once high blood pressure kills them, you don't get them back no more.
Are you a nurse or are you a mechanic?
Huh?
Cause you know about cars. I'm just
I
asking the question. I'm just asking.
like cars, but it's like I kind of put it in a way where people can understand. But when people can understand where I'm coming from, so yeah, it's the leading one of the leading causes of people being on dialysis. You can get a stroke. You hear doctors say your blood pressure is stroke level.
Yeah, I've heard it before. Yeah.
Because high blood pressure is like a balloon. When you blow up a balloon, so it'll burst.
Yeah.
Pressure bursts.
Yeah.
It'll burst it'll burst the arteries in your brain.
Is that what they call people having aneurysms?
Yeah, it can. Like if you blow up, you know how you blow up a balloon and you see a little part that spurts out?
Yeah.
That's like an aneurysm in a balloon. That's what an aneurysm is, a part of the blood vessel that sticks out.
Okay.
So when it sticks out, all that pressure can make it burst. And then it bursts blood vessels in your brain, and that's a hemorrhagic stroke, and you don't do so good with that one. That's one of the worst strokes you can have because it bursts blood vessels and you lose blood. It can cause blindness because it bursts the blood vessels in your eyes. Because one of my friends said she had a patient whose blood pressure was so her eyes were bleeding.
Wow. Okay.
It causes heart failure because you know when you pumping iron, your muscles get bigger because you're pumping iron. Your heart gets bigger because it has to keep up with the pressure beating like that.
Yeah.
So when it's so much pressure, your heart enlarges. But when your heart enlarges, it ain't good. That's called what they call cardiomyopathy. That's an enlarged heart. So when your heart gets enlarged, it don't pump so good anymore, and that causes it makes the heart weaker, and so it can't pump fluids anymore, can't pump things out the body anymore. So you get heart failure. It's kind of bad.
And it sounds kind of bad. It's very bad. Yeah. So what are the treatments for high blood pressure?
Eating right. Eating low salt. Don't get me wrong, you need salt. You need sodium because sodium functions in muscle contraction. It has a purpose, but not the way we eat it. You can have low salt diets that help and cut your stress down.
So how do you cut your stress down? Shay said, here I am. I'm a father, right? And I have children that I guess everyday life. Sometimes when they have problems, the problem weigh on us, or somebody in the family have problems, the problem weigh on us. Like you have a problem, it weigh on me. So how do I separate the two?
If you gotta go to therapy, go to some bad therapy. And it's bad to say, in our community, therapy is looked down on. Sometimes if you can't talk to your family, you need to talk to somebody. And I'm not ignoring God. God is the purpose. It's the one person you need to go talk to. But He also puts people in that position that can help you as well. Because if you need to talk to somebody. Don't just leave things bottled up in you. And the most important, and genetics. Genetics is the cause of high blood pressure. It runs in family, because it runs in my family. You can't do nothing about genetics. But one thing I tell you, do not, under any circumstances, stop taking your medicine. Unless some medications, such as us as black people, lisinopril can cause what they call angioedema. If y'all on lisinopril, anything, it can cause a cough, and it could cause angioedema. Your lips swell. When you see your lips start swelling, please stop taking it, because that's an allergic reaction. You can never take lisinopril ever again, because now it make your throat close up. It happens to us as black people. If you see that, call your doctor and say, hey, my lips are swelling up, and they'll tell you, please stop taking it. You can never, ever take that medicine again.
Never, ever.
Ever. Like smoking.
But Shay, before I ask the next question, Shay, I want to let people know, no matter what you're going through, I can guarantee you one thing, it's going to be okay. as long as you make God a part of your life. That's the what if guarantee.
Yes.
You know, so Shay, what kind of advice you can give to people about dealing with high blood pressure and the signs of high blood pressure, all those things?
So, some people have symptoms. For instance, headaches. Not saying that every headache you have is high blood pressure, because it's not. Because allergies cause high blood pressure. Daily life causes high blood. People have migraines. People have different things that cause high blood pressure. But it's nice to have a blood pressure machine at your house. If it kind of runs in the family, but just sometimes you just shake, may take your blood. Hey, my head hurt, just to make sure that's not the cause of it. Because that's one of the biggest signs. It can make your head hurt so bad.
So could that headache be that balloon like aneurysm about somebody happen?
Not necessarily, because what happens with high blood pressure, again, the body learns how to adjust when you being jacked up. Because your pressure can be high for so long, and your body's like, well, hey, she ain't gonna do nothing about it, so I'm gonna learn how to live with it. So it learns to function off of your blood pressure being so high. So sometimes some people's blood pressure are so uncontrolled, when we drop them to normal, they feel like they're gonna fall out.
Really?
Because they've been living with high blood pressure and it's uncontrolled. We call uncontrolled high blood pressure. When it's like that for so long, their body can't even react to it being normal anymore.
So will the body ever get normal, or y'all gotta let it go high for them to feel like it's normal?
You can drop it. And sometimes we have to slowly. Normally, so the doctors will kind of regulate your blood pressure. We work with it's like doctors, nurses, and CNA. CNA is like our first line of defense a lot of times, because a lot of times, nurses, we take vital signs too, but a lot of places have PCAs and CNAs. They'll let us know, hey y'all, this patient's blood pressure is high. It helps us out because we can see trends, and based on the trends that we see, I can give them a medicine as a nurse, and the doctor says, hey, this blood pressure ain't dropping, so it lets the doctor is either dropping too much or it's not dropping nothing, and it helps the doctor adjust, what kind of meds. They may have to add some meds, they may have to take away some meds. It just depends on, how the patient reacts. And please go to the doctor.
But will they ever get to normal and they feel normal?
Sometimes, yeah. Sometimes, if it's not too far gone, a lot of people, they can't. Once you regulate the blood pressure, they'll be okay.
Anything else you want to add, Dr. Shay?
All I can say is just know your body. People can tell you all the time to ignore yourself, but if you know something about you is abnormal, it doesn't feel right, it's better to go to somebody's doctor than to go to nobody's doctor. Just know your body and look out for yourself.
I like that. Go to somebody's doctor versus going to nobody's
That's
doctor.
right.
Okay. So is that it?
Yes, it.
All right. Y'all heard from Dr. Shay. And like I said, this is going to try to be a every Monday thing. Can I hold you there?
Yeah.
Now y'all heard it right now. She don't come back on the show. We're going don't penalize me, penalize her. So with that being said, this is Lee Craft. This is my podcast. What if you have any comments or concerns, please email me at leecraftwhatif@gmail.com. One band, one sound. Together, we got an opportunity to turn the whole world around. But in order to have a real conversation,
You got to have real people.
if you want to have a real conversation, that's what I'm talking about, Shay. Y'all have a blessed day. Thank you, Shay.